Welcome to Progress Pulse, your weekly look at the developments driving Guyana forward. In the next few minutes, we'll take you through the biggest highlights from across the country, advancements in economic growth, strengthened governance, policy shifts, infrastructure upgrades, and more. Let's dive into the major events shaping this week's national landscape. President Dr. Irfaan Ali handed over a newly constructed home to James Hercules and his family at Enterprise East Coast Demerara on Christmas Day. The house was provided through the Men on Mission program following a request for assistance from Hercules, who lives with a physical disability. Addressing the gathering, the president highlighted the importance of community support and volunteerism, commending the Men on Mission volunteers for assisting hundreds of families nationwide through housing and other social interventions. The annual tradition of visiting mothers and newborns at the Georgetown Public Hospital Corporation continued on Christmas Day, with hampers and care packages distributed to families. At the time of the visit, 5 babies had been born on Christmas Day, with more expected. The visit also included time spent in the pediatric ward, where children received care packages. Healthcare workers were recognized for their continued service during the holiday period. More than 78,000 applicants remain on Guyana's housing waiting list, with over 2/3 concentrated in Region 4, according to the Housing Minister Colin Crowell. The demand is largely driven by the proximity to employment opportunities near Georgetown. The government has distributed over 53,000 house lots in the past 5 years and is working with state agencies to release additional lands. Authorities aim to clear backlogs in all other regions while steadily reducing the demand in Region 4. The Caribbean Examinations Council has announced changes to examination formats for the January 2026 sitting. Paper 1 will be fully electronic, while Papers 2 and 3 will follow a hybrid format. Now shifting to this week's developments. On Monday, Health Minister Dr. Frank Anthony called for improved accountability and stricter adherence to clinical guidelines across disability and rehabilitation services. He announced the establishment of a quality unit next year to conduct clinical audits nationwide. The minister also outlined plans for a neurological and stroke rehabilitation center and reaffirmed commitments to expanding access to assistive devices and improving rehabilitation services across regions. Vendors at the Parika Market in Region 3 have begun operating from newly designated spaces at the market tarmac following consultations with the Ministry of Local Government and Regional Development. The relocation aims to ease traffic congestion, improve safety, and create a more organized trading environment. Officials reported strong cooperation from vendors during the transition. Works are in the final phase of the 1-kilometer mainstay access road on the Essequibo coast, with road markings to be completed shortly. The $187 million project includes a 2-lane asphalt roadway, improved drainage, signage, and safety features. The upgrade is expected to improve access to the mainstay airstrip, support emergency response, boost tourism, and benefit over 2,500 residents in surrounding communities. New vehicle tint regulations will take effect from January 1st, 2026, allowing limited tinting without exemptions. Front side windows must maintain at least 25% visible light transmission, while rear windows may have a minimum of 20%. The regulations include updated fines, exemptions for specific categories, and a 3-month amnesty period, allowing motorists to test and adjust vehicle tinting before full enforcement begins. A total of 107 residents from Region 2 graduated from the Ministry of Health's Patient Care Assistant and Community Health Worker Training Program in Anna Regina. The graduation ceremony, held at the Anna Regina Multilateral School, celebrated the achievements of 59 patient care assistants and 48 community health workers who successfully completed their respective training programs. These graduates are now equipped with the knowledge, practical skills, and professional competencies needed to support quality healthcare services across the region. The graduates are expected to strengthen frontline healthcare services, improve community outreach, and support patient care across the region. Guyana officially concluded its 2-year term as an elected member of the United States Security Council at midnight on December 31st. During its tenure, the country participated in deliberations on major global security challenges and chaired several subsidiary bodies. Guyana also presided over the council twice and advanced initiatives related to climate security, food insecurity, youth participation, and multilateral cooperation. Lastly, on Friday, President Dr. Irfan Ali met with regional officials at State House to review the delivery of government services across the country. He emphasized expectations for improved efficiency, timely implementation, and accountability at the regional level. Several ministers responsible for local government and public service were also in attendance. This has been Progress Pulse, bringing you the major developments across Guyana over the past week, keeping you informed, connected, and up to date.